Is topic number 1. It is the surgery in the nerves of the neck region. Surgeries, exactly the name of the topic, it is vagosympathetical blockade. Look, the author name is Vishnevsky, right? Vishnevsky, it's written here. So you can see this name is written with Vishnevsky. I ask you maximally listen, minimally make the notes because everything is written. Just listen me, please. First of all, let's remember that neck, it is the region with huge innervation. So we have many receptors here. By the way, we have and the receptors which belong to our cranial and spinal nerves. And we have also vegetative receptors, which is located mainly in the organs of the neck. You remember 6 organs we described. Specificity of the neck connected not only with so great innervation, but also with content of the interfacial spaces. The spaces which is communicated with the thorax region. That's like, if technically I imagine injection inside of this connected space, of course by gravity forces the flow of the liquid will spend to downwards to come to the mediastinum, which is the source of the main vegetative nerves. You know, in mediastinum we have vagus, we have sympathetical tracts. Let's say by that injection I can block, the nerves which I mentioned, and I can achieve some goal. Which goal I will say you before. Primary, remember please, in the neck region we perform so-called regional anesthesia. Next year, then you will study general surgery. You will speak. Maybe I will teach you or not. It doesn't matter. We will speak about types of the anesthesia. As you remember, maybe you listen or maybe you study that there are primary 3 types. So-called local, regional, and general. It will be great to say in correct consequence from simple to more hard. Local, regional, and general. Each one has effect. By the way, the most simple effect of anesthesia, it is losing of sensation. That is the primary and the most simple effect. Hardest effect, it is the syncope, it is the amnesia, it is losing of the consciousness. So maximum what can we achieve, it is to switch off the brain. Minimum what we can achieve, it is to lose the sensation. Between these 2 effects, there are a middle effect. It is muscular parallelism and relaxation. That finally we can say that anesthesia gives 3 effects. Loss of sensitivity, amnesia, and finally muscular parallelism. And each form gives some special effect. Local, only losing of sensation. Regional, losing of sensation and muscular parallelism. Finally, general gives all effects which I mentioned before, together with the amnesia. In the neck region, we make regional method. What does it mean? We can achieve the losing of sensation and the muscular relaxation. You can ask me now why it is necessary. You know, guys, in critical condition, or let's call it non-hospital condition, maximum what can you do? It is from point of the view of anesthesia, it is regional one. General anesthesia can be performed only in some hospital or in some, we can say, like hospital condition. For example, you make some temporary hospital, not building, something like the camp with some necessary equipments, for example, in the war conditions or in some catastrophical situations. But in majority of the cases, you will not have enough equipment to make the general anesthesia. What do you need? Minimum, you need the artificial respirational system. Because in majority of the cases, it is inhalational forms of the anesthesia. We have also intravenous one, but mainly inhalation. They say maximum what can you do in non-hospital condition, it is regional one. It means you can achieve losing of sensation and you can achieve the muscular parallelism. Ask me why it is necessary. especially if we have internal traumas. Traumas which is reach internal organs, which is reach the cavities. Such kind of traumas, you remember, we call penetrating. Penetrated traumas reach the cavities, damage the serous membranes, which is contained huge amount of the receptors. You know, trauma of the serous membranes, it is critically painful. Why the persons with, for example, acute abdomen have so developed pain? Because peritoneum is irritated. Peritoneum, for example, acute appendicitis, peritonitis, cholecystitis, it gives the irritation of the peritoneum with severe pain reaction. Much more severe pain we will have if the trauma will be happening of these structures. For example, pulmonary trauma, pleural trauma, peritoneal trauma. All these problems gives shock pain reaction. I told you before, it is the most intensive pain of the human organism, which can even kill us due to the damage of the centers in the brain by the hyper-intensive impulsation. So how to stop it? By anesthesia. Which anesthesia? Maximally regional. Why the neck region? Due to the two specificities. Specificity number one, huge amount of nerves. Specificity number two, connected spaces, which I mentioned before. If I will make injection of the liquid inside of the spaces, they will simply spread inside of the mediastinum and give the goal which I need to achieve. Is it understandable for you? Brilliant, I'm happy. Friend, can I ask you to help me, because I will show something. Now, stand up by the face to your friends, and if it is possible, turn your head in opposite side. You can see the sternocleidomastoid muscle. First of all, position of the patient, usually in the back, or in the opposite to injection site. For example, we see that mainly trauma located in right. Of course, I will make injection in the same side. By the way, we try to not make double-sided injections. Why? Due to the possibility of formation of apnoea. If you will close the impulsation from both right and left vegetative nervous system, and of course the phrenicus nerve also will be involved in this anesthesia, it will make the parallelism of the diaphragm. Okay, that's a patient located in the back, usually under the shoulders. We put the pillow to give the extension for the neck region. Then I turn the head in the opposite side, and I see sternocleidomastoid muscle. And what I need to find, the midpoint of posterior margin of SC. Midpoint of posterior margin of SC. Before any incision, because I am right-handed person, I will put my left index in this point and will make the pressure. Approximately to make depression, which is equal to half of centimeter, not more. Don't press it more. For what it is necessary. Now by my pen, I will try to modulate the position of external jugular vein. You remember it is passed from the level of angle of the mandible up to the level of the midpoint of the clavicle. And you can see that it is cross our SCM approximately in the midpoint. Let's say then you make the pressure in the point which I described you before, you replace external jugular vein from the place of your future injection. Thank you very much, friend. You can see it now in your place. What after? After the pressure, I take the necessary equipment. I need long needle, more than 7 centimeters in the length. And I need usually big injector, because you will inject it big amount. Big I means 20 milliliter and more. You connect it needle with injector without removing of your finger. First of all, you put for the needle approximately horizontal position, maximum 5 angle degree. And you make first your injection just in the depressed place inside of skin. You injected 2-3 milliliter of the liquid and you form lemon peel, like the blister of the skin. Skin is protrused here, and why we call it lemon peel? Because you see aperture of the glands, like in the peel of the orange or in the peel of the lime, lemon. It has the specific form. You make injection, you remove your needle. Again, you don't remove your finger. Your finger still in press. And now you directed your needle approximately perpendicular to the skin, but little bit descended tip of your injector to down to give approximately 85-degree angle between tip of your needle and skin. Now my needle directed from superficially to deep and little bit from downwards to upwards. In this direction, strongly from midpoint of our lemon area, which we discussed before. So that is our SCM. We find it the midpoint of posterior margin of SCM. We make here the lemon peel, and now in that point, I start to make injection. How we do this injection? Remember, please, step of your perforation approximately equal half of centimeter. So, you perforated half of centimeter structures, you injected approximately 3-4 milliliter of the liquid in front of your needle. Again, you perforated half of centimeter, again you injected approximately 3-4 milliliter of the liquid. Then your needle passed approximately 1-1.5 centimeter, you can remove the pressure. Because you go deeper to the fatty tissue, you cannot damage more any superficial veins. Superficial veins, it is, will be more superficial. Why you need to make this injection? Two purposes. Just simple anesthesia, but much more important, hydraulical preparation. It is press the small structures and open the way for your needle to prevent the traumatization of the nerves, of the vessels, which can be in front of you. So you make injection, the stream of the liquid clean the space in front of you, and then only you push your needle deeper. Finally, how much I will go? Then you will press your needle into 6-7 near centimeter. It will come to the anterior surface of transverse process of C6, C5, and will touch to the bone. Then it is touched to the bone, you feel it, you understand that you come to your final destination, and you finish any injection. But what to do after? Now, if I will start to make my final bit, because I didn't inject the main volume of my liquid, primarily we must make injection of 60-70 milliliter of the anesthetic. It can be Novocaine, lidocaine, Trimecaine, different liquid anesthetic. But sorry, not near the bone. Sorry, not near the bone. Why? Now look, let's modulate it. Which space is located near the bone? I will be fifth fascia. I am covered the vertebra. Between me and our friend will be the space which is called osteofascial space. It is not the interfascial, because it is formed between the fascia and between the bone. But you know what is specificity of it? It is closed. It is closed because, as you remember, fifth fascia fused with the vertebrae and finished. So, what will be happen if I will make injection in this space? I will increase the pain. Why? Because mechanoreceptors will be irritated. Sorry, then you make injection inside of any closed space, it is painful. Because mechanoreceptors is irritated, they give the high pain. So what should I do? 1 minute, look to me. I touch to him. I pull back into approximately half of centimeter my needle to back. It means from the space which we mentioned, it is become immediately to another space, which is called retrovisceral. Now, I am the fifth fascia, which is covered here. But the wall which is behind of me, it is the visceral layer of the fourth fascia. And the space which you see between my back and the wall, it is the retrovisceral. Then you pull back your needle from the space which I mentioned before, it is become to the space which is located in front of it. And immediately here, you start to make your injection. How you do it? Primarily, you injected what is inside of your injector, then you disconnected the injector from needle, again fill it by the solution, again connect it with the needle, and again inject it. If you locate it in the proper space, liquid is simply flow from your injector into the space. If you make injection in the closed space, you must press your injector, because inside of it there are the high pressure. Finally, this 50, 60 milliliter or 70 milliliter connected with each, yeah, because you understand. For example, some anesthetics can have toxic effects, you know. Lidocaine make the blockade of the conducting system of the heart. So you must understand how much for which age, for which gender even, of anesthetic you should use. But anyhow, okay, I injected this liquid. How I can understand, am I doing it correct or not? You remember I told you before, and now I want to show. We will see specific signs in the site of injection, which we call Horner-Bernard signs. That is triad of the signs. Ptosis, meiosis, and end of tau. Ptosis, you know, eyelid is descending due to the blockade of the innervation. Meiosis is constriction of the pupil. By the way, the simple light reflex can show for you that dilatation is absent. Yeah, we have only constriction. And finally, end of tau. I will go a little bit back. You see depression in the side of the problem. Again, all these problems connected with the blockade of the vegetative nervous system, blockade of the vegetative nucleation. And usually also, in the side of the injection, you see the hyperemia of the skin. If you see these signs, it means you make great, brilliant, without mistake, your manipulation. You achieve your goal. If you don't see these signs, unfortunately, it means you make injection in non-correct space. You must do, in majority of cases, repeat it.
So then, if it is done in the wrong side, what are the other symptoms it should come?
Which another symptoms? First of all, if your patient, 1 minute, if your patient doesn't lose the consciousness, you can just ask him, does it help him or not? Intensiveness of the pain is decreased or not? That is the most simple symptom which is possible to be checked. But if your patient doesn't have the consciousness, of course you cannot ask anything. So you will subjectively understand it, yeah? And the best method to understand it subjectively, that is use this Bernard-Horner signs, which is simply can be identified and to see. What to find else except it, I don't know. What you can find? Sorry, vagus will not be find it, and you will not make the electro, for example, physiological investigation to see the impulsation is spreading by the nerve or not. So that's impossible. Complications of the problem. The main one, of course, it is perforation of the vessels. You can perforate it, carotid neurovascular bundle, especially, look to me, in majority of the cases, carotid neurovascular bundle is perforated, then you directed your needle from back to in front. Because then it is strongly perpendicularly located to the skin, you pass behind of the carotid neurovascular bundle. Then you even little bit push the tip of the needle to in front. It means you perforate it from back side to in front, yeah? You remember immediately under the SCM, yeah, near the trachea. By the way, if you will do it, you can simply perforate it on torus. Because as you understand, in front of the trachea, yeah, in front of the vertebra, inside of the omotracheal triangle, we have 6 organs which I teach you. They say, touch wood, don't give for the needle such kind of position. Needle will be strongly perpendicular and a little bit directed to upwards. If you will direct it needle to downwards, you can damage the plexus cervicalis. During the perforation, you can damage the branches of plexus cervicalis, which is from deep muscles, become to the subcutaneous fatty tissue, and make innervation of it. Say, don't do it. This is mainly, if you, of course, don't press before the injection, you can damage external jugular, which I said before, which can give simulation of air embolism. We also discuss it. That's it. That is the main complications which we can have. If you will do double-sided vagosympathetical blockade up to complete apnoea, especially for the patients without consciousness. Because if the person have the consciousness, he will use the intercostal muscles to make forced breathing. But sorry, if no consciousness and you don't have, for example, artificial ventilational equipment, it will be mortality. Or you will make the exact immediately breathing from month to month, up to hospitalization and up to, for example, switch the equipment which is provided the respiration origination. It is understandable for us. Very well, thank you very much. Now write the next topic. It is the tracheotomy, tracheostomy. Simple translation say that tomy is cutting, stomy it is formation of the fistula. But if we say real definition, it means the surgical manipulation, which is open inferior respiratory system for artificial respiration. Immediately air from our environment enter inside of the inferior respiratory tract and go into the lungs. That is the meaning of this surgery. What is indication? Because point number one, we must understand for what we do it. Now remember, please, nowadays we can mention 3 necessary conditions for this surgery. Condition number one, it is so-called problem which we call palliative surgical necessity. What does it mean? There are unremovable volumetrical process of the respiratory system. Doesn't matter, it is upper respiratory or lower respiratory obstruction. Anyhow, there are obstruction, air normally cannot pass by the respiratory system. What can I do? I can make the puncture, and through this puncture, air by the tube, which I will insert it inside of the respiratory system, can go into the lungs. Case number 2, if you need to make the long-term artificial ventilation, but the problem doesn't immediately connect it with the pathological problems of the respiratory system. For example, coma of the patient. You will make long-term respiration. You can say me now, let's make intubation. Let's insert the tube inside of the upper respiratory. Yeah, we can do it. By the laryngoscopy, I can make intubation. But if this tube will be left long time inside of the oral cavity, it will make the trophic ulcers. Because it will press the soft tissues in this region. Usually, guys, intubations can be continuous maximum days, 2, 3. But not the weeks, and of course not the months. So if you need so long-term manipulation, that is not the best decision. And try it, please. Turn the most problem. It is, of course, asphyxia. Asphyxia, impossible to breathe. Asphyxia. You can see how it's written. Asphyxia. Meaning tension to me. It is simple to say asphyxia, but it is not too simple to understand all cases, which is give the formation. Generally, cases divided into 5 groups. You can write it because I have not written it here. Now, all possible reasons of asphyxia. Reason number 1, mechanical problems. In the brackets, write please. It is foreign bodies in the respiratory system. Or it is traumas of the respiratory system. Foreign bodies or the traumas. What does it mean? 1 minute, look to me. What is foreign body? You understand, yeah? You put the candy, or child put the toy, and during the breathing it goes into the respiratory system, or part of the food, anything which is possible to imagine. What is traumatizing mechanism? For example, fracture of the cartilages of the larynx. Again, mechanically they destroy, And of course, it can give formation of the swellings, yeah, and obstruction of the respiratory pathway. Continue, please. Case number 2. It is the allergical problems. Allergical problems. From quick disease up to the simple food allergical reactions or contactogenous allergical reactions. What is in base of such kind of the pathological conditions? Perciò. E galet banere stomatologinere apăr. Mena cara ghes dase, mă vorbe să apăr.